Well, welcome to the Innovation Health Jam, and this is the remote patient monitoring track, and it's really great to be part of this. My name is Joe Kavita. I'm the director at the Center for Connected Health at Partners Healthcare, and have been part of the field for 20 years, and I can safely say that in 20 years, things happened fairly slowly until very recently, and now it's exploding. Situations where we would bring technology into a patient's home to help them record vital signs for heart failure monitoring, and they already have an iPad and are wondering why they can't use their tablet. And the other one is where a patient that we would offer a blood pressure monitoring program where we bring them the technology, already has a cuff that they purchased, again, in one of these consumer electronics stores, and wants to know why we can't import the data from the mobile device. So there's lots of, I think, controversy there, and not to mention the reliability of these devices, the integration challenges. But I want to throw it out for folks to talk about how they think that's going to play out and exactly what the first steps will be to bringing those two worlds together, because inevitably they will collide.
You described something very interesting for those of us in healthcare, which is enterprise chief information officers are worrying about this coming BYOD, bring your own device world, where people have decided, I'm not going to listen to what you want to give me, I've adopted something I like and I want to use it to be more productive. The cost of devices themselves is getting cheaper. That idea that we can take a powerful multifunction device and put it into somebody's hands for essentially no money in comparison to what medical devices and other things cost opens up such a tremendous world. And if you layer that on top of the fact that here in the United States and elsewhere in the world, broadband is becoming ubiquitous. Mobile broadband is becoming at least more accessible, if not less expensive, depending on where you live. The fact that everybody has a high-speed data connection connected to a very versatile multifunction computer in their pocket, it just leads to astounding possibilities.
Just building on this, I think we are only at the very beginning when it comes to understanding what could be done with bringing together different data streams. If you imagine that you would have daily feedback data from chronically ill patient populations, where currently you only have like data sets every 3 months or so, that's just opening up so much opportunity for predictive analytics, for really improving the health status of these patients, and at the same time become much more efficient. So I think we are very much, and I keep saying this, at the end of the beginning.
I'm certainly no behavioral modification expert, but I would imagine that there's a series of things that we need to move along the continuum to get any one person to behave differently, and it's probably a combination of things like incentives and coaching and feedback, and I'm sure there's a social component and so forth. So if we can use these digital breadcrumbs, and I do like that that word, to make sure that we tailor the intervention to that specific person, and we can get those dials in the exact right spot to change this person's behavior, then I think we'll have it right, and we can certainly use that data to drive real change in healthcare. We're
really had an exciting conversation here around some very powerful topics, such as consumer connected health, integration into the electronic record, provider payment reform, and big data. What more could you ask for? These are all going to be covered in the Panasonic Tech Jam, and we'll be part of it. We know you should be part of it as well.